Good afternoon. Welcome to this CHOP Cancer Center Family and Patient Town Hall. We are delighted to have you with us today. This town hall is the first in a series of monthly town halls that we've created in an effort to communicate better with you during these very unusual times. We're hoping that these town halls will provide you with some useful information to support you and your family. Today's topic is managing education when you're dealing with pediatric cancer. And I just want to give you a little bit of a rundown of what we're going to do today. First, since it's on everybody's mind, we're going to have a quick update on the COVID pandemic with Dr. Susan Coffin from our Infectious Disease Division here at CHOP. Next, Dr. Lamia Barakat, who is our Director of Psychosocial Services here at the Cancer Center, is going to discuss our seminar and present our main speaker, Chris Belk. While everybody is talking, the chat room will be open, so if you have questions or comments, please enter them in the chat room. We're going to leave lots of time at the end of the meeting to answer hopefully all of the questions and comments. So to get started, I'll hand it over to Dr. Coffin from the Infectious Disease Department.
Hi, everybody. It's a pleasure to be here talking about a topic which has become a little too familiar, but it does have a very interesting intersection with coronavirus and education. I'll just speak about coronavirus and give you a little bit of the lay of the land nationally and some comments about what's going on in southeastern Pennsylvania. So the national numbers are large and sobering. We've crossed the 23 million mark of new cases or of cases. And if you want to try and think about what that means, one way to think about it is last week, the average number of cases per day was 22,000. And so that gives you a little bit of a sense of the scale, the daily impact and rate of rise that's going on. It's still very, very high. We've just crossed the 400,000 mark for deaths due to coronavirus. And last week we marked having on average 3,600 individuals dying of COVID. So the experience we had last spring of many deaths due to COVID hasn't really passed. Locally, we're doing a bit better in southeast Pennsylvania than we had been immediately after the winter holidays. The rates of disease and test positivity rates in the 5 counties of southeast Pennsylvania are all declining. Most counties can claim a test positivity rate under 10%, which is a great achievement, knowing that some had weeks where we crossed the 20% positivity rate just in the past month alone. However, the threats aren't over yet. Our neighbor to the east, New York, is amongst the states with the highest number of new cases per capita. And similarly, Florida, Texas, and California are battling again with really dramatic surges in disease activity. I thought I'd also spend just a moment commenting on where we are with vaccination, because I think a lot of us appropriately see this as part of what we need to get to in order to emerge safe and sound on the other side of this awful pandemic. To date, there have been over 12 million doses of coronavirus vaccine administered to over 10.5 million people. Overall, though, there remains a fairly significant gap. By most people's estimates, there are about 20 million doses out in the communities which have not yet made their way into people's arms. And I'm cautiously optimistic that the next week or two will provide us new strategies to be more effective in distributing and quickly administering vaccine. There will likely be some changes to the modest changes to the priority ranking for who will get vaccine, and it remains to be seen exactly where people with high-risk conditions, including cancer, will fall in that ranking. But I would hope that they will be moved into the 1B strata. And it depends on where you live, but 1B may be a strata of vaccination that will be starting soon. With that, I'll turn it back to Anne.
Thank you, Dr. Coffin. That was really helpful. So now I'm going to introduce Dr. Lamia Barakat. Dr. Barakat is the Director of Psychosocial Services for the Cancer Center here. And then Dr. Barakat is going to talk with you about our speaker for today.
Thanks, Dr. Riley, and thank you, Dr. Coffin. Good afternoon. Good afternoon, everyone. It is such a pleasure to welcome you to the first of a monthly series of patient and family cancer center town halls. We decided, because we are often hearing from parents concerns and questions about hybrid school, virtual school, in-person school, and this is parents of all ages, that a good starting point for our town halls would be to have a presentation on education during the COVID pandemic. So it's with pleasure that I introduce you to Chris Malcolm Belk. Chris is our outpatient education coordinator at our University City campus. He is a certified special education teacher, and he's taught in public and chartered K-12 schools in Philadelphia. He's also taught college composition and remedial reading. Chris earned his bachelor's degree from Swarthmore College, his master's degree in special education from Arcadia University, and his master's of fine arts in creative writing from Northern Michigan University. Of all the subjects Chris has taught, his favorites are third grade math and college writing. So he can really span questions related to students of all ages. In his role at CHOP, Chris works with patients and families to maximize school functioning. This involves communicating with patients' teachers and school teams, as well as providing patients and caregivers with the tools they need to advocate and thrive in school. So with that, I'd like to welcome Chris to the screen to present on education during this pandemic.
Thank you, Lamia. I really appreciate the opportunity to present today. I know that there are likely caregivers of patients of a variety of ages, as well as diagnoses and kind of where they are on treatment. So I've tried to make my presentation as broad as possible. I know that sometimes school issues can just get so granular and specific to your child's situation, but hopefully there's something here that can answer some of the questions that you have. I'm going to share some slides while I'm talking. There's a whole lot of information that I'll be presenting, but some of the most important resources that I talk about in the presentation are going to be shared in the chat at the end so that you don't feel like you have to be frantically writing them down. Getting my presentation up. It'll take 1 second. Okay, so I'm going to talk about school supports during virtual and hybrid learning because that is kind of the main issue that folks are facing right now. But while I talk about that, it's kind of impossible to talk about how to get support during virtual and hybrid learning without talking about the underlying support structures that many of our patients need, especially 504 plans and IEPs. So these are the objectives that I've set. We're going to talk about communicating effectively with school staff. A lot of the patients and families that I support, they're really able to be very effective advocates for their children. They've had a lot of practice because their children have received so much medical treatment. And sometimes it's really just understanding the system of school and how people communicate within a school that can unlock some of the supports that are needed. We're going to talk just a little bit about schools' responsibilities and our patients' rights regarding accommodations and special education supports. There are a lot of questions about what schools are legally obligated to do during this time. Hopefully we'll come away with some concrete tips for making learning from home more fruitful for learners and less stressful for caregivers. Of course, this is going to be a stressful time for parents and children everywhere, and especially for families that are already struggling with the amount of medical treatment that many of our patients are getting. Little slide delay. So this is a sad picture of what it used to be like to communicate with your child's teacher. You could kind of show up at the end of school or at school conferences and talk face to face about some of the issues. And a lot of times that would let some of the tension out of the room and help really solve these problems. And without this available to us, we have to Change our communication method. These are some of the most common challenges that I'm seeing patients and families report. The first one is communication isn't timely. It's hard to get in touch with their teachers. You're not sure what platform you're supposed to be using. Are you supposed to be emailing them? Are you supposed to be calling someone at the school? Are you supposed to be using one of the many portals that schools are using for communication? Another issue is parents not feeling like they know how their child is doing. This is especially an issue with middle school and up, so middle school, high school, and then for some of our college age patients who do still need some support from their parents. With so much of the communication online and going directly to patients' email inboxes, right? Even if a child's in 6th grade, they might be getting emails directly from their teacher about how they're doing. And some caregivers really feel like they're left out of the communication. A lot of our patients, especially the ones who are receiving active oncology treatment, school agrees to reduce assignments, but then they don't give clarity about what exactly is due, and our patients are logging into the school portal and just seeing dozens of due assignments and not sure how to prioritize their time. Because our patients aren't in front of their teachers, teachers often can't see how much students are struggling, and their caregivers are bearing a lot of the brunt of the support. They're seeing the child crying because they don't understand the math lesson, but in front of the camera, the student doesn't look like someone who's experiencing distress. Sometimes as a caregiver, you feel like a child is having a problem with one school staff member in particular, but you've only got the email address of someone else. So you're emailing the homeroom teacher, but the real problem is with the math teacher. Some of our patients who have special education plans are seeing that some of their services aren't being delivered as you agreed upon with the IEP team. And some of our students are old enough to email, but they're being given either too much or too little power over controlling their own communication. Some of our patients are missing a lot of classes or refusing to attend their classes, and often their caregivers don't even know that that's happening. And finally, college students, especially those who are starting out their college career, are stuck managing a lot of their own communication. So a lot of the issues that patients are experiencing have to do with communication breakdowns. These are some general guidelines that I use to encourage positive school communication. Sometimes communicating with school can be surprisingly antagonistic. So first, the role of the CHOP team. We're here to support our patients and their families, but CHOP isn't an educational entity. So we can make recommendations, and many members of the psychosocial team talk directly with school team members, but we can't make school do what we wish they would do. So a lot of times, although we can help with advocacy, caregivers are going to have to take on a lot of the brunt of the advocacy work. I know this sounds very simple, but asking for what you would like to see is sometimes, I'm so sorry. Sometimes just asking for what you would like to see can really solve some very simple problems because teachers have never taught online. And since you're often supervising your child, you know what they might need. So you can ask simply for something like, sitting in a half-hour math class is really straining my kindergartner, and I think after 15 minutes, he needs to turn the camera off and run around, or he needs to just take a screen break and close his eyes for a moment. It's always important when you have a conference scheduled with a teacher or another school staff member to write down every question you have and then make sure that question is answered before the communication is over. Try not to wait until the situation is completely out of hand to ask school for help. Sometimes it can be very difficult to communicate with school staff and the communication turns really negative or ends up being about how everybody's struggling right now with online learning, or it's so difficult because I never know what the principal is going to ask of me. And when conversations get off course like that, it's important to bring it back to your specific concerns and not let, I wouldn't call them excuses, but these kind of generalizations about school take over the conversation about your child needs to be at the center of this. And finally, I'm going to share some of my favorite resources to know your child's rights. But children who have serious health conditions such as cancer have a lot of rights in the school setting, and knowing what they are, even in a basic sense, really, really very helpful. And in this time of hybrid and virtual learning, it's unbelievably difficult sometimes just to get the right email addresses and know how to communicate with the people who are involved. So right now, for a lot of high school students, they're getting new teachers because it's a new semester or the semester is ending this week. I would say to encourage your child to share their teacher's email addresses with you. And if that's not possible, I have found that calling school or even the school district office is sometimes necessary to get staff email addresses. You would think that by this point, schools would upload all of the staff email addresses, but that's just really not the case. And having to search around for the right people's email address when there's suddenly a very serious problem is going to cause a lot of frustration on your part. Schools are using a lot of different communication tools. I know that I have seen schools use apps like Class Dojo to communicate with parents, and others use email. Some use Google Classroom or Google Groups. I think making sure that you know how school is communicating with your child and how the best way is for you to communicate with them is really important. My advice is always that email is a really good way to communicate with school because you'll have a record of it, and some apps, it's harder to get back to where you were in the conversation and remember exactly what was promised or said. If your child has a new school staff member, send an introduction email as soon as you can, just to let them know that you're someone who's going to be in touch with them. I found that during online learning, unfortunately, a lot of caregivers have to be the squeaky wheel in order to get school staff to respond. So here's some more specific ways to solve communication problems. One is when you're feeling like you just really don't know how your child is doing, establishing a concrete schedule for communication with school staff can be really helpful. It's going to depend a lot on how your child is doing in school and how much they're able to participate in school at this time. But at the very minimum, you should be having quarterly conferences scheduled with your child's teachers. And I would say that for kids and teens who are having more of a hard time, you might even want to schedule a quick weekly or every other week check-in through the portal or through email just to make sure that everybody's on the same page about your child, how your child is doing. That ensures that your child won't tell you a week before grades are due that they actually owe 12 assignments and need your help getting them done. That's going to create a very stressful situation. Patients are going to do better if they know what's expected of them. And unfortunately, sometimes our patients are being told that their healthcare needs are going to be respected, but they don't have the specifics of what that's going to look like. So making sure that your child knows what is due when, how their assignments will be modified, and everyone should consistently know what's due and be on the same page. I find that sometimes our patients are told things like, you can have extra time, but the teacher doesn't say exactly what that means. So if your child has accommodations such as extra time or only doing half of the math problems or something like that, your child should know exactly what they're supposed to hand in and when. It's useful too, if you don't feel like you need to talk to the teachers every week or every other week, to come up with alternate times at which a teacher would have to call you. So for example, if your child's missing more than 2 assignments or their grade drops below a C, in a 504 plan, you can say at that point the teacher should contact the family. Because I know that some caregivers of older patients who are in high school really want their child to be doing a lot of the learning on their own, but it's also good to have the safety net of knowing you'll be contacted if things aren't going well. Sometimes you feel like you're just not hearing back from people, and I find that including other members of the school team can sometimes be really helpful. So I'm going to talk a little bit about what the role is of people other than the teacher in communicating with school. So many of my patients' caregivers are very much able to just communicate with the classroom teacher, especially in the lower grades. A first grade or second grade teacher is going to be the main point of contact for a patient and family, and often most of the issues can be solved just by communicating with that one person, which is great. The school nurse I find is most useful when school doesn't seem to be understanding how serious our patients' health conditions are, or if school is kind of backing off too much and doesn't expect our child to learn things that, we really want them to keep up with their peers and learn the basic information that children at their age and grade band should learn. So school nurses can help just because they have more healthcare knowledge and they can tell teachers and school staff what might be appropriate for a child based on where they are in treatment. And they can kind of communicate on an ongoing basis with caregivers about health needs. Often the school counselor is sort of like a facilitator for the school team, especially if a child has a 504 plan, so they can help make sure everyone is on the same page. This is helpful to include the school counselor if teachers aren't really, some teachers are following the plan, but others aren't. Sometimes our patients and caregivers really need the assistant principal or principal to be involved. If teachers aren't following the 504 plan or they're not being supportive enough. And if the issue is something that must be delivered through an IEP, for example, if we think a patient needs more one-to-one support or a different kind of math or reading class, a special education case manager or director should probably be involved in even basic emails about the patient. I know it can sometimes feel like you're being adversarial if you start CCing people on emails, but actually I think it solves a lot of the issues because it increases communication. Because it used to be that these people would be in the same building all the time and they would pass each other in the hall and be able to have a quick conference, but that's not really happening anymore. So emailing more and more school team members can really help. I'm going to briefly talk about higher ed just because that's usually not the main focus of presentations that I give like this, but I know there are some questions about higher ed. So in higher ed, our patients are still covered by Section 504, so they do have rights to some accommodations, but they might not get robust supports like they used to when they had an IEP. Patients are going to kind of take on a lot of the responsibility for communication, and they communicate with the Office of Disabilities. Patients will need to be proactive in disclosing their disabilities and working to come up with a plan. Sometimes patients who are going to cancer say, I don't know if I need the accommodations and I'll contact the office when I do. And sometimes that can get you into a sticky spot where you're waiting for help that you have had in the past and you just weren't sure if you'd need it again. I think it's always good to get a plan in place and then to back off the supports if you're not using them. Patients can sign a waiver so that their parent and caregiver can be involved in some ways with higher ed, but that doesn't mean direct communication with instructors usually. So a lot of higher ed is really about the patient taking control of the communication. These plans aren't set in stone and they can be altered and changed depending on how things are going or what kind of course load patients are taking. A lot of college disability offices, this is especially important for online learning, may have priority registration as part of their plan with disability services. That can really help make sure that a patient is getting the courses that they're going to need for their major or for graduation, and that it's on days and times that work for them if they're receiving medical treatment. I'm going to talk a little bit about special education rights during COVID-19. So special education law, which is very convoluted and complicated and sometimes difficult for parents to engage with, it hasn't changed during COVID-19. Caregivers can still request an evaluation for additional supports. IEP meetings should still be happening on a regularly scheduled basis. And the IEP team should be keeping track of how patients are doing in terms of meeting their goals. And services should be delivered with as much fidelity as possible, as agreed on by the IEP team. Students with cancer who are in public school settings should be served by a 504 plan or an individualized education plan. In almost all circumstances, our patients can benefit from some supports. You as a parent or caregiver can be understanding about the constraints that the pandemic has placed on school while also advocating for your child. I completely understand. I've been a teacher for a long time, that this is not an ideal situation or circumstance, and that schools are going to have to change their game plan, but the basic support structures that support our patients are still in place, and our patients still have a right to have their educational needs met. This is a slide that I put in almost all kind of education related presentations that I give, just explaining briefly what a 504 plan and an IEP is. I'm going to just take a moment because I know it's a lot of visual information. There are a lot of available explanations online about the differences between Section 504 and IDEA, but the easiest way to explain when a patient would need an IEP is that they need specialized instruction provided by a special educator or a therapist, such as a speech therapist or an occupational therapist, in order to participate in school. There hasn't really been a delay in getting a 504 plan in my experience due to the pandemic, because the process is usually pretty simple. Your child's medical provider works with social workers or other members of the psychosocial team to supply a letter that explains the child's diagnosis and their need for accommodations. The school counselor, school nurse, whoever is in charge, and participants of the school team can have a virtual meeting about a 504 plan. And honestly, in most school settings, a 504 plan is a very simple document, and it doesn't take a whole lot of time to develop. Every teacher who works with a patient should attend the meeting or read and sign the 504 plan. It's great to have a good plan in place, but if not everyone is on board, it can lead to a lot of confusion and frustration. These are just a few examples of 504 plan accommodations. Common 504 plan accommodations, such as having an elevator key or extra time to pass between classes or using a roller backpack, might not apply. And I've seen some schools say that that means they should delay starting a 504 plan. That's definitely not right. Students who are learning online often also need accommodations to learn. I am not going to go through the whole process for obtaining an IEP because it would be a long presentation that sort of stands alone, but generally a parent or caregiver writes a letter to the school team referring their own child for an evaluation, or school sees that a child is struggling to keep up with their peers and they will refer them for an evaluation. This is where I've seen a lot of the problems associated with the pandemic, because staff like physical therapists and school psychologists might not be seeing children in person. But at this point in the pandemic, schools have usually figured out a way to evaluate kids. And it's really important as a parent that if your child is in need of an evaluation for supports like speech therapy, that school's able to figure out a way to do that evaluation. So an IEP, unlike a 504 plan, which is sometimes even just 1 or 2 pages, an IEP is often 40 or more pages. And it has a lot of information. The most important thing is just that it has annual goals for a student to make progress in the areas where they need specialized instruction. One important thing just to pause on as it relates to online learning is this extended school year, or ESY. Many children who have an IEP and get special education services are eligible for services over the summer because they're likely to lose some of what they've gained, or they just continue to need that level of support. And I've seen more and more school teams extending ESY to our patients for two reasons. One is that they might not be making the progress or getting the robust supports. They're getting the supports, but it's not really the same online to get something like physical therapy. Or school had a gap of providing the services. For example, they didn't figure out a way to provide OT online, and a patient missed a certain number of sessions. The school might offer it over the summer. It's really important, if your child is missing out on a service that they should be getting, to take note of how many minutes or hours they're missing of the service. Okay. There's a rainbow here because I'm hoping that I can give just some information that would be helpful to make online learning a bit more fruitful. These are some of the challenges that patients and families are having with online learning in its daily practice. And I can't say that anything that I'm going to say is going to solve all these problems, but sometimes you get so stuck in a pattern of difficulty on a daily level that having just a few routines shaken up can really help. So there's difficulty finding and setting up a productive workplace. I know that our patients and caregivers live in a very wide variety of settings, so I'm going to try to be mindful of that when I talk about setting up a productive workplace. Setting a schedule that's reasonable in terms of its demand, that's an instance in which we only have so much control because some schools are demanding so much screen time of their students. How to manage the workload, especially in light of medical treatments. A challenge is understanding the content. What is it that my child's supposed to be learning? And also, I don't like to use the phrase new math particularly because it's just math, but I know that that's not how I learned it when I was a child. So I know that a lot of caregivers struggle with understanding how their child's teacher is teaching, especially math. And then because of online learning, there's just more responsibility than usual on a child to organize themselves and set priorities, which can be difficult, especially for our patients. This is going to be in the chat, so don't feel like you have to write all this down, but I just really want to draw your attention. Since the pandemic started, I feel like I've read every resource for parents about making online learning a bit more bearable, and I really found that this Vanderbilt Iris module series was so helpful and extensive and has a lot of outside links that are specific to a child's age and what they need. So I can't recommend this enough when you see it in the chat at the end of the presentation. So I'm going to talk a little bit about effective workspaces. Some of our patients, of course, they're tired or ill, so they may be working from bed, and I completely understand that. And also, teachers should absolutely be understanding of that and allow our patients to work with their cameras off and take lots of breaks. Given that, if that's not your child's situation right now, it can be helpful to set them up with some sort of official workspace. That could be anything from taking 5 minutes to convert an area of your kitchen table into a workspace, or it can be something like purchasing a small desk if you have space for that. I know that with older patients, it can be really hard because they work in their room with the door closed. But it can be helpful to negotiate a time when you can pop in just to see if everything seems to be going well. Reducing outside distractions. It's obviously impossible for a lot of us. There are a lot of folks who are working from home. There's other people in the house. You're living in a small apartment. So I get that that's not always possible. But think about the place where you live and where a student might be able to study with the fewest distractions. Sometimes it might mean shuffling around where things have been happening in your house. If you have multiple students learning at home, it can be a nightmare, especially if they're sharing a small working space. So you can use things like poster board, like what you would put a science fair experiment on, or pieces of cardboard to divide kids and make them feel like they have more of a workspace. That's something teachers often do when they use a more open classroom setting like round tables. you can try allowing your child to change their seating throughout the day. So for example, they attend all of their lessons seated at their desk, but then they're allowed to sit on the couch when they're doing their math program. So, changing the seating, especially if attention is a difficult thing and you have a kid who's in kindergarten and wanting to run around all the time, you can do something like set a timer, and every 15 minutes they can change the seat that they're in. You can also use teachers to check in about whether the space is working. Like, hey, I know that my kid is 11 and wants to be independent and he's locked in his room all day. Like, it doesn't seem to be working out. Is he paying attention? Is he on his phone? What are you seeing when you see him? You can really collaborate with teachers this way. They really know when someone's paying attention or not. So some patients are on an online program that has them in like back-to-back Zoom, and that comes with its own issues with eye strain and fatigue and screen time. But some patients are being asked to structure their own time in a completely unprecedented way. For my patients, this is most common if they're attending school on a hybrid schedule. So they might go into their building 2 or 3 days a week and attend school just like it's, a regular day with fewer students and COVID precautions. And then on the other days, they sort of have all this work they're supposed to do, but they're not given a lot of direction on how to do it. So depending on a child's age, you build their daily schedule around the expected school schedule. That might help with a hybrid schedule. So in school, you do reading block for the first 90 minutes of the day. Why don't you do reading first thing in the morning on days when you're supposed to be doing your own work? This also with, high schoolers who may want to sleep a lot on days when they go to class. Working with them on a compromise schedule could be helpful. I've had patients tell me that they're not starting their schoolwork till 3 or 4 p.m. And I know that people are different, but that's probably not going to work out too well. There are ways to make it easier for your child to follow their schedule, especially for kids if you just feel like you're trying to get other things done and you're just having to babysit them constantly. You can use reminders. If you have something like Godot or Google Home or any of those kinds of devices, you can set reminders for your child to get on different class if they're supposed to switch classrooms. You can get a very inexpensive digital watch that's set to alarm them when it's time to get on class. Some schools are using Google, like Google Classroom. You can set up a Google Calendar, and I even ask a teacher to help them set up a calendar with links. Try to, shift the burden off of yourself so that you're able to do some parenting and not just be a school assistant all day. For younger children, especially, a visual schedule, such as a printed schedule that's pasted near a workspace, maybe next to a clock, right? Put all of the expectations for what they're supposed to do near them. And finally, you might have to work with the teacher to balance expectations for active participation, especially if you're dealing with a child who's getting medical treatment and isn't always feeling well. It might not be reasonable what school is asking of them. So sometimes you do have to have a difficult conversation with the teacher where you look at the schedule together and decide what's most important. A lot of teachers don't want to say that some things that they do aren't as important, but when a child has cancer and is getting a lot of medical treatment, there just are some things that are going to be less important than other things. I find that some of my patients during online learning are in a sort of double bind of increased access. Before COVID, they might have really struggled to access a lot of their coursework. They were waiting for teachers to mail them packets in the hospital, or they were on homebound and only getting a few hours of homebound instruction a week, and that was sort of their whole access to school. Now teachers have uploaded all of the resources and materials and assignments that they're using online. The problem is, a lot of times schools are saying things like, oh, whatever she needs is fine, or do work when you feel well. And those statements don't really mean anything. They don't help our patients know what's expected of them, what's the most important thing to do. If a patient is only feeling well, 1 week out of the month, knowing what the most important assignments are in their class to do during that week can be really meaningful. So teachers are ex-curriculum and instructional methods, but most teachers don't know a lot about oncology treatments. So you're really going to be the expert on how your child is doing day to day and what you think is reasonable for them to participate. You might have to work with the teacher to set expectations, and I think it's really important that the patient, whatever their age is, that they know exactly what's expected of them. So if school says, we're going to prioritize assignments and we're only going to grade what so-and-so hands in, that can be a really tricky situation because some kids are going to say, well, that means I don't really have to do much. And other kids are just going to feel very anxious and upset by all of the assignments that they're seeing in their online portal. So teachers should really be hiding assignments that are optional or that they want our patients to do if they're able. I think that this is a really hard time for patients who have total access to everything their teacher is uploading, but aren't well enough to actually complete all of the assignments. I know that as caregivers of CHOP oncology patients, a lot of times folks are really wearing a lot of hats. They're helping their kids with so many different things and supporting them through medical treatment. And it's really adding being a full-time educational assistant onto that can be so overwhelming. Obviously, there aren't very many kindergartners, first graders, and second graders who can completely do their schooling independently. That's not really a reasonable expectation. But if you find that you're sitting next to your child and having to read every assignment and constantly guide them, it's possible that your child does need more different academic support. Maybe they have an IEP and they need some more time with their learning support teacher. Or maybe they have a 504 plan when they're going to need their assignment load reduced. On kind of the other hand, if your child isn't given space to attempt their assignments, teachers won't know that they need some more help. So, of course, you want to assist your child, but if you're really prompting them through every single problem on every single assignment, their teacher might not be able to adjust things based on their ability because they won't see that the child is struggling. It's good to ask teachers for additional resources, support, time, and modeling. There's folks at CHOP like me and other hospital school program teachers, education coordinators, social workers, neuropsychologists who have a lot of resources, and we love to share them with patients and caregivers. But asking teachers for what they use can be really useful because a lot of teachers teach now integrating those resources that they rely on directly into the materials that they're giving students, so it can be more seamless. This is something a lot of folks don't think about. You can ask for physical materials even if school is completely closed and there are no plans to open at this time. Some schools are handing out materials. This can be especially useful for patients who have visual impairments, asking for large print materials, or if you have adaptive technology that you use at home to see things. Screen reading can be useful, but also very tiresome if you're not completely competent with the technology. So asking school for physical materials, this is not limited to textbooks and large print materials. It's also, you can ask for things like if the occupational therapist uses special pencil grips or a vision therapist uses a slant board, you can ask school if there's any way that you can get your hands on the assistive technology that your child needs to learn and access their educational program. Sorry, my dog is barking in the background. So help with executive functioning. A lot of our CHOP patients are having even more struggles than before with executive functioning. And when I say executive functioning, I mean cognitive skills like starting tasks, self-monitoring. Those are difficult for many students, but especially a lot of students who have had oncology treatment struggle with these skills. These are skills that can be addressed in a 504 plan or an IEP. And I just want to give some of the some ideas to jumpstart your thinking about things that might benefit your child in school. Some schools have a homeroom that has a study skills element because a learning support teacher or other staff member who knows a lot about executive functioning is the homeroom teacher. Direct learning support in organizational strategies and tools. Learning support teachers or other special educators don't only teach reading and math, right? We have to teach basically whatever our students need. That's our profession. So if a student is really struggling with organization, with doing multi-step tasks, with shifting from one task to another, those are skills that can be addressed in an IEP. Especially for patients on a 504 plan, regular meetings with a counselor can help. A lot of counselors also help many of their students with executive functioning and study skills behaviors. Modifications to assignments. Modifications to assignments like chunking larger assignments into smaller pieces and using checklists can be used online with a lot of ease. And then I think, all right, this is my kind of last slide, some more tips for college students. So at baseline, even when it's not online learning, most college work is asynchronous, which is a huge difference from high school. A lot of patients are used to in high school, you're listening to someone talk to you all day and then you have smaller homework assignments. But in college, it's the opposite. You might sit in a course for 2 or 3 or 4 hours a week, and then all of the bulk of the work is on you. So when the semester starts, make sure that you kind of poke around the interface that the professor is using. They likely are going to use different ones than you've seen before, things like Blackboard. So make sure that you understand how that works. Use the syllabus to plan the semester. This is my kind of ultimate takeaway. Early on in the semester, you can use a timer to see how long it takes you to do something, like one weekly math assignment. Obviously, assignments are going to vary, but it's not going to vary that much how long it takes you to do a 5-problem set based on what you learned that week. So figure out how long these common college assignments take, and then use what you learn to actually schedule daily study time, like it's a job. And that way you can schedule it around things like a job or doctor's appointments or leisure time, right? Using a schedule can be really helpful. And making sure that you highlight at the beginning of the semester what your most difficult weeks are. Unfortunately for college students, the professors are not communicating in the way that they do in high school. So a lot of times everything sort of is due at exactly the same time. So you're going to have really difficult weeks during a college semester. So make sure that you plan for that. More studying time the week before and the week of, and then maybe a break after. So my kind of final parting note in the presentation is please let someone on your child's psychosocial team know if you're really struggling with school functioning. I know sometimes there's so many resources available at CHOP, and school functioning is something that there are many people here who know a lot about and can help. Depending on the level of your child's need, you might just need some resources sent or a very brief consultation or more involved contact with a CHOP staff member. It's pretty flexible how educational supports are provided. So I really appreciate folks listening to all that talking. Trying to figure out how to end. There we go.
There we go.
Thank you very much. That was I think many of us are still here on the presentation. Some of us have our cameras on, and I think if anybody has questions, please put them in the chat, and we'll try to answer them. I see there was one question that looks like it was maybe for Dr. Coffin, about what impact the new UK variant might have on the region, or whether it's too soon to tell. And then it looks like we had a question about the extended school year. So I don't know.
Hey, I just popped on. If
okay.
You'd like me to take the question about the variant.
That'd be great. Thank you.
You know, this is such a rapidly emerging and evolving story that I don't think I can provide a lot of concrete information other than to say that viruses mutate as part of their natural function. So even before coronavirus, we would track virus spread by tracing their mutation rates. The thing that's caught people's attention is that there appears to be an association between increased transmission and some strains' mutations. What we can say is that it appears that The tests, virtually all still are able to detect the variant very well. The current vaccines seem to raise antibodies that neutralize the variant vaccine or variant virus. And then last, that the variant virus does not appear to have any more severity. So I think those are things that are beginning to be known and are very reassuring. But I think the big picture story about how widespread this is, whether or not this is going to change this spring, the fall, the winter and spring of this year, we don't yet know.
Okay, thank you very much. That's really helpful. I appreciate that. If anybody else has any other questions, let us know. If there are questions that come into the chat after we're finished, we'll be able to maybe answer some of those and put some of the information on our website. For those of you who are interested, it's actually buried in the question, in the answers to one of the questions. Mia Benson-Smith has posted the special education process, that great online resource from Vanderbilt, and also some other information about resources for CHOP Cancer Center patients and their families, about education laws, the special education process, and some other information there. I want to thank our speaker, Mr. Buck. That was a great presentation and full of tons of information. I feel like I learned a lot. So I think that was really great. And hopefully this has been recorded. So we will be able to post the recording. And if you guys are interested to go back and review some of the information, it will be there in the recording. So we want that to be available for people. And then again, there are resources in the chat there that people can access if they'd like to. Okay.
I just wanted to see if Chris wants to address the role of extended school year through hybrid or virtual learning. The last today, and we'll wrap up.
Sure, yeah. So extended school year is a part of the IEP for many students. There are a lot of myths about ESY. Some people think it's only for children who have certain disabilities, such as an intellectual disability or autism. That's definitely not the case. It's for any child who presents with a need for their educational program throughout the summer, because they're likely to stop making progress if they're not being afforded that program anymore. So I do think that often in the IEP, it's sort of like breezed over, right? It's like a 40-page document and they're like, ESY, nothing to see here, and just turn the page. And I think it's important as a caregiver to say, well, hey, let's slow down a second and talk about whether this is something that my child really needs and would benefit from. It's usually a little bit shorter than the school day. It's usually like an abbreviated program, but many students benefit from participation in ESY. And I think a lot of parents, honestly, are in a really good position to ask for it, even if their child hasn't had it before, because school's been so different this year.
Thank you. I see actually one more question. I'm sorry. I'm just going to take a quick and answer this question, if that's okay. The question is, what is the oncology department's position on patients attending school in person? I'm happy to, I think happy to hear what the other speakers say. I will say that in general, we have felt that if the school is operating in person, that by and large, our patients should be going to school unless their physician feels that there's a reason for them not to be in a school setting. In general, we've been doing that, and luckily at this time, the schools that we know of that have been in school have been seeing very little transmission if they're following the rules and doing things correctly. And so I think it's a decision between your child and your child's physician and what the school is doing. But in general, we've been very supportive of our patients attending school in person. I think that's it.
Thank you so much, everyone. This was really very informative. And as is coming up in the chat, in addition to what Dr. Riley said, we will have video, a recording of the presentation on our website, and we'll also make Chris's presentation available, the actual slides available to you on the website as well. So thank you so much, everyone who presented, as well as all of the attendees. We're so happy that you joined us for the first Patient and Family Cancer Center Town Hall. Have a good evening, everyone.